it sing for me? You, can you feel me? There's a rainbow always after the rain. Good morning, good morning, good morning. Welcome back to my channel. Welcome back to Pherl TV. In today's video, what is our topic? Button your seatbelt and now we will go. In today's video, our topic is the question on heart disease and sex, okay? There's one question from a client of Dr. Willie Ong. By the way, I will be using this book of Dr. Willie Ong in order for us to review the concerns pertaining to heart attack and the issue on sex, okay? I bought this book maybe 2011, if I'm not mistaken. Yes. And right now, because I am already blogging, I have to review this book for us to raise an awareness to all people who are living this concern. The first question of a client, of a patient of Doc Willie Ong, which accordingly the name is not withheld upon request. The question is, the statement is, my doctor says I have heart disease. I want to know if I can have sex without the pressure. Will my heart stop if I have an exciting sexual encounter? That is the very first question, okay? So the answer of Doc Willie Ong, as stated in the book, is as written, okay? From the tone of your question, I can surmise that you are not planning to have sex with your wife, okay? This is the writing of Doc Willie Ong. A study shows that having a sex with your usual partner is safer and would make you spend just a minimal amount of energy. However, having sex with an unfamiliar and younger partner would make you spend twice as much energy. The excitement, the unfamiliar territory, and the desire to prove your manhood further add to the pressure. Okay. So that is the answer from Doc Willie Ong. Accordingly, from the question of the man who was asking if it is safe for him to have an encounter. And then he has a problem as far as heart is concerned, and he's asking if it is safe for him to do such thing. From the reply of Doc Willie Ong, he stated that maybe this man is planning to have an affair with extramarital affair, okay? So, if that will be the case, and if the man is older, for sure it will be find another young woman, okay? And doing such thing, it will be requiring him lots of energy in order for the woman to what do we call this? To enjoy, for the woman to feel the, what do we call this? The satisfaction, okay? So this older man would able to exert so much effort to prove his manhood, okay? In Tagalog, yung lalaki, mas magiging wild siya kapag ang kapartner niya mas bata sa kanya, sapagkat papatunayan niya na still he is capable of doing such thing. In that case, what happened? The blood pressure rises, okay? And if he is not taking the proper medicine, the medication, now the heart attack will possible to happen, okay? But the good thing in this concern, Doc Willie Ong have outlined the following safety measure for that situation. Okay, number 1, according to this book, take your regular heart medicines before sex. Number 2, let the healthy partner do the work or be on the top. Okay? Number 3, don't have sex after a heavy meal. Or wait after 2 hours. Number 4, schedule the sex act in the morning if possible. And number 5, get a medical clearance from your doctor to check if you are allowed to do these things, okay? Another question raised by one person to Doc Willie. Accordingly, the question is, why are male friends having heart attack? This comes from a person who is 54 years old. According to this book of Doc Willie, for all the men out there, I have some bad news. We are more prone to get heart disease than the ladies. Based on statistics, men also die earlier than women. Our life expectancy is an average 3 to 5 years old, shorter than a female. Okay? To the question of that man to Doc Willie, the answer is here. The reasons are twofold. Genetics and lifestyle, okay? When we say genetic, it is hereditary, and when we say lifestyle, it is the way, the proper nutrition that we're doing to ourselves, okay? It has long been known that being a male is a risk factor for heart disease. This is especially true if one or both of your parents have heart disease. That is why. That is what I'm talking. When we say genetics, this is hereditary, okay? We can what we call this? Inherit from our parents the illness such as heart disease. Some experts attribute this difference to behavioral and cultural factors. Men are expected to work more and thus have to handle more stress and pressure. Okay? So, men are responsible for earning. That is why most men are the one who are being the victim of heart attack. Young men are being groomed by society to be macho and to hide their emotions. Okay, moreover, more guys smoke, drink alcohol, and abuse drugs. Men also have greater fear of doctors than women. Totoo. Thus, they see a doctor when it's too late already. Yeah, that's the problem among men. They are not, they don't rely on the doctors the very first time that they feel something bad in themselves. They are self-medicating, okay? So what is important is from time to time, we have to go to the doctor if we're feeling something that we feel that it's really bad for us, okay? Health is the best gift that you can give to your wife and your kids. So please, Daddy, please keep up the good health. Number 3, another question raised to Doc Willie accordingly. I've been taking metoprolol, a heart medicine, for 12 years now. Lately, I am not strong in bed as I once was. Is it the medicine I'm taking? Okay. This is Roland, the 50 years old. Okay. Roland is asking if the reason why he is not very much functional in bed is asking if the medicine that he's taking. Okay. If that is the one who attributes to his weakening in bed performance. And the answer of Doc Willie, it could be, but I doubt it. You have been taking your medicine for 12 years already and have done well with it. So, we shouldn't blame it for what you're experiencing right now. However, It is true that some medicines like the beta blockers can affect the sex drive. These are drugs whose generic names end in the syllable OLO or LOL, kind of like metoprolol and atenolol. Okay? The advice of Dr. Willie for that question of the man in number 3 is to see a doctor before stopping the medicine, since they are really excellent drugs for the heart. I believe this is just a psychological thing, as per writing of Dr. Leong. Your doctor may shift you to another class of medicines for high blood pressure. According to Dr. Willie Ong, erectile dysfunction or impotence could also be due to uncontrolled diabetes, older age, excessive alcohol, and smoking. Patients should not be ashamed to ask their doctor. It is part of the doctor's job to care for your sex life. Number 4 question of Ninita at 27 years old. Okay, at this point, this girl is already the one who is asking. Why is it that my heart beats very fast when I get excited or nervous? What's the first aid in this situation? For that concern of Ninita, the writings of Doc Willie on here is, during times of emotional stress, the body releases a certain hormone called epinephrine. This hormone is a built-in mechanism of the body to fight off danger. You have heard of somebody being able to lift a sofa all by himself during a fire, okay? Well, that's epinephrine. It's bring out the Superman in a man. The heartbeat can go as fast as 150 heartbeats per minute during stress. Aside from emergencies, more common situations like getting angry, giving a speech, or worrying a lot also releases other hormones. A little stress is alright, but too much stress will put undue strain on your heart and may cause it to fail. According to this book also, as per writing of Doc Willie Ong, for anxious people, I sometimes prescribe a sedative which is very effective in relieving temporary stresses. You can take it if you need it, but just don't take it too open, okay? Wag daw laging magkukonsume nun. Better yet, try to breathe slowly and deeply, and think of peaceful place to suit your mind. According to this book also, as per writing of Doc Willie Ong, for anxious people, I sometimes prescribe a sedative which is very effective in relieving temporary stresses. You can take it if you need it, but just don't take it too open, okay? Wag daw laging magkukonsume nun. Better yet, try to breathe slowly and deeply, and think of peaceful place to suit your mind. We're done. Yes, we're done with the 4 questions on sex and heart disease. I hope that you have picked an information pertaining to this concern and you can apply this into your lifestyle. Okay, as far as lifestyle is concerned, we will be talking it on the next episode of this Health Corner of Pherl TV. Good evening, good afternoon, and thank you for watching. I hope you would love to subscribe to my channel if you're not yet done with it, okay? So, what are you doing right now? If you have a minor concern or major concern, don't get late in going to your doctor, okay? Thank you for watching. There's a rainbow always after the rain. Take a little time, baby. See the butterfly colors. Listen to the birds that sing for me and you. Can you feel me? There's a rainbow always after the rain. Good morning, good morning. Thank you for watching. See you again later.